Hi, all. Thanks so much for joining Making Healthcare Work for You, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Prakash Patel, who is the CEO of MaxHealth. And it was such a great interview. Again, I love talking to him and hearing how passionate he is about the importance of relationships within primary care and how we need to shift our thinking around both the engagement of it. And he also said behavior modification, but we need to shift the behavior and the thinking around why people are doing it and incentivize it. He mentioned multiple different scenarios, going to airline chains that offer rewards and shopping experiences that offer you some kind of reward, whereas the healthcare system is built around intervention once you are sick. He really wants to go far into the prevention and making sure that we're building relationships. And as with so many people we've talked to on this show, he's really passionate about value-based care, where it's not just a churn and burn, trying to get people in and out, because you can't develop that relationship. And so that's what he's working on at MaxHealth, trying to be able to build these relationships with people, creating a way. He mentioned, just the way that people are engaging with their systems and their clinics, and trying to touch base with that and connect with them to something that motivates them, so that it's not a scary thing to go seek care. Apoorv, what were your takeaways?
Yep, I agree with you, Stephanie. I think that it was so insightful. I found that he thinks deeply about the topics. I've known him over the years. He's actually been a guide and mentor to me. It's just a delight to reconnect with him, to see all the different areas that he's worked in, and then how he's trying to bring it together to actually deliver value-based care, which is a clear passion of his. He really wants to change the way in which care is actually reaching the patient, how it's impacting the patient, helping them to achieve their outcomes. He talked quite a lot, as you were mentioning, about parallels with other industries, especially like, say, the banking sector, where now the experience is so streamlined that we don't really even think about it, and we're getting what we need. And then at the end, we were probing a little bit. So why is that? It's because people want wealth. It's something that they perceive, but the process just needs to be easy. Maybe that's the paradigm for healthcare. Ultimately, at the end of it, yeah, you had brought up the point yourself that people are scared about healthcare in some way. They're scared about the interventions. They're scared about what they might want to find out. But ultimately, they want health. So is there a way, such as the happiness score that he was talking about, the net promoter score, maybe there's a health score that really just needs to be in place that allows us to know how are we doing on this thing that we actually do want. So we keep not trying to shy away from it, running away from it, which allows us then as consumers to better engage, and then folks like Prakash to build better systems for engagement. So I just found the whole topic very interesting. I'm looking forward to continuing our dialogue with him, and I hope our audience finds something to take away that they can implement back in their practices.
Absolutely. And if you haven't already watched the interview, be sure to go back and watch that, because it's a great one. We'll talk to you soon. Thanks so much. Bye-bye.
Take care now. Bye-bye.